Hello, and thank you for watching this educational video on osteoarthritis, commonly known as OA. My name's Tia. I am trained as a certified athletic trainer and a health and well-being coach. I spent over 8 years as a clinical staff member in the orthopedic department, treating many patients with this condition. Currently, I'm in a role as a health coach and a care coordinator with lifestyle medicine. This video is a collaboration between both St. Luke's Orthopedics and St. Luke's Lifestyle Medicine. My goal is to help educate people on how to live with OA, reduce their pain, and overall improve their life. Today I will discuss what osteoarthritis is, current medical treatment options, and self-management with lifestyle change. I'll also review resources to help you live a higher quality of life while managing your osteoarthritis. A joint is any place where two or more bones connect, like the knee, hip, or shoulder. In a healthy joint, cartilage covers the surface of the bones and allows it to move smoothly and pain-free. When you have arthritis, the cartilage that cushions and protects your joints breaks down and wears away. Where there was once smooth articular cartilage that allowed the bones to glide easily against each other, there is now a frayed, rough surface. Motion along this exposed surface can cause damage and be painful. Symptoms of OA include pain, limited motion, and stiffness of the affected joint. Symptoms can vary from day to day, but change only slowly over the years and may even level off or improve at some point. Let's talk about risk factors. You are more likely to have OA if you have excess body weight, as this weight adds stress on your joints and can change the normal shape of the joint. Excess fat tissue also leads to inflammation that can break down cartilage. If you have a history of injury to a joint, as that previous trauma can cause damage to the joint over time. If you are physically inactive, as the lack of exercise and movement can cause your muscles and joints to get weak and stiff. It's important to know that activity isn't harmful and if done at the right intensity can be protective. If someone in your family has arthritis, you may be more likely to have it too. Repetitive occupational joint stress can also be a cause. If there is a certain motion or activity that you do repetitively, such as frequent bending or kneeling on hard cement, if that repetitive motion causes pain, it may be contributing to your OA progression. There are a few other factors that increase our risk. Now, these include age, and while age isn't a direct cause of arthritis, we know that as we get older, we're more likely to have symptoms. In fact, 80% of people over the age of 55 have some X-ray evidence of the disorder. However, not all people with arthritis on X-ray have pain. And loose or odd-shaped joints. An example of this would be at our knees. Some people have knees that bend outward that look bow-legged, or knees that bend toward each other, such as knock knees. This can cause an imbalance in the joints because the cartilage wears down at an uneven rate. OA is commonly diagnosed with X-ray imaging. As you can see in the knee on the left, there is space between the bones, allowing bones to move easily. On the right, you can see the space is diminished and movement would cause the bones to rub against each other. Your provider will be looking for this narrowing of joint space, for the presence of bone spurs, and other abnormalities. If X-rays do not show a source of pain, your provider may order additional tests, such as an MRI or a CT. Here is another X-ray example, this time of the hip. You can see narrowing on the picture on the right compared to the healthy hip on the left. Now, the interesting thing about OA is that sometimes people can have severe OA on imaging, but do not have terrible symptoms. And in these cases, we don't rush to treat. Again, imaging doesn't always equal severity of someone's pain. This is good news, as it means you can have severe OA on images, but take steps to limit your symptoms before you need medical treatment. Unfortunately, there is no cure for arthritis. However, there are several measures that can relieve symptoms and reduce the risk of OA getting worse. There are three main categories of treatment. Non-surgical treatments include some kind of medical intervention or use of a device, surgical or operative treatment, typically in the form of a joint replacement, and self-management or decisions or steps that you can take. Non-surgical treatment options include the use of medications, physical therapy, joint injections, assistive devices, and complementary medicine. Medicine can help reduce your symptoms of arthritis, but it doesn't cure arthritis or slow the time it takes for cartilage to break down. Start with a topical cream. Diclofenac or Voltaren gel is an anti-inflammatory topical that is available over the counter. If not providing relief after a few weeks, Capsaicin cream is another medicine that can be directly applied to the painful area. There are medicines that can be taken by mouth in pill form. Acetaminophen, also known as Tylenol, can help with pain. Anti-inflammatories taken by mouth are frequently prescribed to reduce inflammation in the joint. There are many types, and some are available over the counter, such as ibuprofen, also known as Motrin or Advil, or naproxen, which is also known as Aleve. There are also types that must be prescribed by a provider. If two people take identical drugs and doses, their individual responses may be considerably different. It is sometimes necessary to try one drug for several weeks, then try a different one. It's important not to be taking two types of anti-inflammatories at once. Discontinue one before trying another. There are also many potential risks with taking an anti-inflammatory medication by mouth, and they are not safe for everyone. For example, this type of medication is not safe for those with heart disease, congestive heart failure, kidney disease, high blood pressure, stomach or GI issues, and if you're taking a blood thinner or have a history of bleeding issues. There are fewer risks and side effects with using an anti-inflammatory cream or gel, which is why it's highlighted on the slide and recommended for use starting first. You should only be using one form of anti-inflammatory. You should not be taking an anti-inflammatory by mouth and using the gel. Opioids should be avoided and have no place in non-operative or preoperative management of OA. They are not advised for pain and will not be prescribed by St. Luke's providers due to the many risks and the reduction of effectiveness over time. It is well established that patients who use opioids for pain management before surgery struggle with increased pain and difficulty managing pain following surgery. Additionally, opioids are highly addictive and have a risk of drug interactions, and patients that use them are at higher risk for falling and having fractures. The goal of physical therapy or a home exercise program is to make daily tasks and activities easier. Your physical therapist will work with you to make a treatment plan that fits your problem and your needs. The goals can include reducing your pain and swelling and increasing your flexibility, strength, balance, and endurance. They can share ideas for activities and exercises that will make your joint stronger and even teach you to put less stress on your joint by moving in a certain way. If you have increased pain or swelling after a physical therapy session, you may be pushing too much. If you haven't moved in a while, some pain is normal, but if something really bothers you, be sure to tell your physical therapist. An injection into an arthritic joint is a frequently offered treatment option. Having an injection can decrease pain and the use of pain medications. Injections into some joints, such as the knee, are typically done without imaging, where an injection of your hip or shoulder may require the use of ultrasound guidance, so the provider can see where the injection is going to ensure it gets to the right place. Cortisone is an anti-inflammatory. It reduces inflammation and swelling. Unfortunately, over time, it can worsen the severity of OA by decreasing cartilage volume. Therefore, it's recommended to limit cortisone injections to several times a year. An important note for patients with diabetes: a steroid injection can raise blood sugar levels. These patients should pay close attention to their blood sugar levels following an injection and stick closely to a diabetic diet. Hyaluronic acid injections, more commonly known as Visco, are only currently available for knee arthritis. The goal of these injections is to lubricate the knee. These injections do need approval from insurance, and if not covered, it can be a high cost to the patient with an uncertain benefit. Assisted devices take stress and weight off your joints and make it easier to move. For example, canes and a walker provide support with ambulating. Raised toilet seat provides functional help by decreasing how much our hips and knees must bend to get into position. Braces, most used for the knee, can provide a feeling of security. There are even some specialty braces your provider may recommend depending on the area and severity of your OA. Movement of our joints can also slow progression and help with our pain. We will discuss the benefits of exercise in a moment, but know that use of exercise equipment that makes no to low impact activity possible, including a stationary bike, can be very helpful to adding movement. Complementary medicine includes many non-standard therapy treatments. In most cases, not much is known about how safe or how well they may work. None of these have shown much effectiveness for improving pain or function of OA or affecting its progression. Some people do swear by them and that they have helped. Here are some of the commonly used complementary treatments: acupuncture, dry needling, massage, supplements such as glucosamine, chondroitin, and turmeric, and experimental treatments: platelet-rich plasma injections, stem cell injections, and amniotic cell injections. The decision to have surgery is between you and your doctor, and considerations include your age, health, activity level, and how much pain and disability you have. Most people have surgery only when they can no longer control arthritis pain with medicine, have tried and failed to have relief with other treatments, and when pain really interferes with their lives. While joint replacement is the most common surgery for arthritis, there are times where other options might be considered. Ultimately, your doctor will let you know what surgery is the best option for you and your condition. By far, the most recommended surgery for OA is a joint replacement. This is done when other treatments haven't worked. It involves surgery to replace the ends of bones in the damaged joint. The joints that are replaced most often are the knee, hip, and shoulder. Overall, there is great success with these procedures. Self-management is the third category of treatment. It refers to you controlling certain aspects of your life without medical intervention. Studies show that patients who use self-management strategies report a greater improvement in quality of life and decreased pain compared to those not actively working in these areas. Self-management can make a difference in osteoarthritis in three key ways. First, preventing the progression of OA. Second, improving pain and function. And third, improving the success of joint replacement surgery should you elect to proceed with operative treatment. There's a lot of overlap in each of these areas, meaning if you are doing things to prevent the progression of your OA, you are also doing things to manage your symptoms and setting yourself up for success with surgery. Taking an active approach to self-manage your OA, you are also taking steps to improve your overall health. Let's take a look at this list of risk factors again. We've discussed treatment options that would likely be suggested by your provider. There are several risk factors that are under your control. Now we will discuss actions that you can take on your own to address these risks. Self-management techniques include achieving a healthy weight, avoiding weight gain, being active, activity modification, and getting rest. Staying at a healthy weight or losing weight if you are overweight is the #1 modifiable risk factor in preventing progression of OA. We know that being overweight causes an increase in body inflammation and increased pressure on our joints. Extra weight puts a lot of stress on the large weight-bearing joints such as the knees, hips, and balls of our feet. Experts estimate that for every pound of body weight you have, there's an extra 4 pounds of stress to the knee. This means if you lost only 5 pounds, you could take 20 pounds of stress off your knees. You don't have to get to a normal weight to have success in pain reduction. Studies show that just 10% of weight loss has been associated with a 50% reduction in pain for those who are overweight or obese with knee OA. Weight loss by exercise and improved diet, specifically by increasing vegetable intake, has been found to decrease symptoms more than weight loss by exercise alone. Additionally, losing weight, there is also a reduction in the risk of other health problems such as cardiac disease or diabetes. Activity is also an important self-management strategy. Many people are surprised to learn that exercise may make them feel better, reduce joint pain, and make it easier to perform daily tasks. Movement prevents progression of osteoarthritis by lubricating our joints and keeps our cartilage supplied with nutrients. Additionally, it keeps our muscles strong and flexible. The stronger your muscles are, the more weight they can handle. As a result, the bones in your joints carry less weight, and your damaged cartilage is better protected. If we stop moving, our tissues can shorten and increase our stiffness. Of course, for those things that seem to worsen our pain, we may need to consider finding an alternate activity or to decrease the intensity or duration of that activity. Cycling and swimming and also water aerobics are great low-impact activities. Activity that causes swelling can worsen our joint pain, so keep in mind the Goldilocks principle here. Movement is good, but too much that's too strenuous and you may cause increased inflammation. Find joy in your movement. Exercise doesn't have to be a chore. It's important to find something you enjoy so you'll do it on a consistent basis. Enlisting a friend is always a good strategy. One of the main exercises recommended in the orthopedic guidelines is Tai Chi. Tai Chi has been found to be helpful by helping with balance, strength, flexibility. It can even help with fall prevention, as well as have an impact on decreasing depression. It combines gentle, graceful movements with deep diaphragmatic breathing and relaxation. Few additional tips can help you exercise safely. First, pace yourself, especially if you haven't exercised in a while. Start slow and build in time and intensity. Second, manage pain. Some people are confused at when to use heat versus cold. Know that both can work well to decrease your pain. A good general rule of thumb is to use heat immediately before exercise and to ice after. Keep in mind to always have a barrier, such as a dish towel, between either a heating pad or a cold pack and your skin. And third, rest your joints if they are swollen. For example, if your knees are swollen, don't use the stairs for a few days. Walk a shorter distance and maybe switch to swimming or riding an indoor bike. There are other conditions that affect OA symptoms. Poor sleep quality and untreated anxiety and depression can worsen pain. Therefore, treating sleep problems and addressing our mental health can improve our symptoms. Learning to manage stress and adopting pain management and coping strategies will also improve how we handle pain. Often adding exercise to your routine can also have a positive impact in these areas. Those who use tobacco have increased pain levels compared to those who do not. These patients also tend to have worse outcomes and higher complications should they proceed with surgery. For this reason, we recommend discontinuing the use of all tobacco products. If you and your doctor decide surgery is the right option for you, there is evidence that taking certain steps before surgery can improve a person's results, while also helping avoid complications related to surgery. Long-term pain following surgery is a concern. People with certain risk factors can develop persistent pain after surgery despite no obvious surgical complications. Those most at risk are those who struggle with excessive pain before surgery, those who have uncontrolled chronic disease such as diabetes or high blood pressure, those who have unmanaged depression or excessive stress and anxiety, those who have multiple joint pain and a low sense of vitality. By taking an active role to address risk factors before having surgery, you can decrease your risk of long-term pain postoperatively and improve your quality of life following surgery. Another major concern of pursuing surgery is the risk of complication following the procedure. While not all risks can be eliminated, by limiting those factors that we know increase our risks, we are more likely to have a good outcome. Here are a few conditions that we can address before surgery that can affect our outcome. Addressing poorly controlled diabetes. Reduce your A1C under or equal to 8. Those with poorly controlled depression and anxiety should pursue treatment with counseling and/or medications or lifestyle changes prior to having surgery. Work to lose excessive weight. Most surgeons recommend a body mass index or BMI of under 40. To find your BMI, you can enter your height and weight into an online calculator or ask at your next medical visit. In quitting tobacco, as users have poor wound healing and are twice as likely to have an infection following surgery. As just seen, self-management encompasses a lot of areas of our health, and many of us have areas of opportunity. By losing weight, adding activity, treating depression and other mental health conditions, by adopting stress management strategies, treating our sleep problems, developing a healthy eating pattern, and avoiding tobacco, we can slow progression of our OA and improve our pain and function. By addressing these areas, we also lower our risks of complication should we decide to have surgery. We like to talk about developing self-management strategies like these as making lifestyle change. It can be extremely difficult to make lifestyle changes that stick and become our new habits. Often we can start something and be strict for a short window, such as being on a diet for the short term or getting started an exercise program, but long term, these changes don't stay. This can be very hard. St. Luke's has taken the steps to provide a program that offers an opportunity for you to have help and guidance with this process. This is an opportunity for you to take control of your care. St. Luke's Intensive Lifestyle Medicine program addresses each of these areas. For years, it has taught these self-management strategies to those who have had severe disease, such as suffered from a heart attack or struggled with severe lung disease. But this program has recently been made available to the general public to slow or even stop the progression of developing disease, including osteoarthritis. St. Luke's Intensive Lifestyle Medicine program is medically supervised with lifestyle medicine certified providers who communicate directly with your medical and orthopedic providers. It includes health coaching and behavior change classes to help you in making permanent change, exercise plans to help you increase activity, nutrition and cooking classes with opportunities for individual dietitian consultations, stress management, and opportunities for individual counseling, and sleep management with insomnia treatment. There are also opportunities to work with nicotine-dependent specialists to help you with tobacco cessation. As a bonus, if you have cardiac disease, recommendations to improve symptoms of OA and cardiac disease really go hand in hand. You will improve your overall health and your OA. You can learn more by looking at our website that can be found at stlukesonline.org and searching for intensive lifestyle medicine. Should you want to learn more, there is also a free informational session to discuss this program in detail. You can call our front desk at 208-706-9710 or stop by the South Meridian YMCA Monday through Thursday for more information. St. Luke's offers a free program that is open to anyone who wants to quit any form of nicotine. It's an intensive, medically supervised intervention that provides one-on-one counseling at your convenience by phone. Your nicotine-dependent specialist will help you identify triggers, develop an action plan, and teach techniques to avoid relapse. Your counselor will also be in touch with your medical provider if you need medication to help reduce withdrawal symptoms. You do not need a referral and can learn more by searching for nicotine dependence at stlukesonline.org or calling us at 208-706-9710. Insomnia Education is a class that provides tips on how to improve your sleep hygiene, explains cognitive behavioral therapy for insomnia, and how to proceed with scheduling an assessment with a licensed clinical social worker or behavioral health specialist if needed. An assessment is needed to determine if you meet criteria for a diagnosis of insomnia and to be referred to CBTI treatment, which is a 6-session group treatment series that takes place virtually over Teams. To sign up for a class, search Insomnia Education at stlukesonline.org or call 208-381-9000. Refresh is a 4-week virtual nutrition education course on using food as medicine through whole food, plant-based nutrition. Each week you will be assigned education modules to read or watch at your own pace, followed by a once-a-week 30-minute facilitated group check-in on Microsoft Teams. You will also have access to a group discussion board with your group and facilitator for additional support and discussion. This course is led by lifestyle medicine dietitians. You can find out more by going to stlukesonline.org and searching for Refresh. You can also sign up by calling 208-381-9000. PVO is a 12-week virtual program for behavior change support. Group sessions are facilitated by dietitians and other lifestyle medicine professionals with video content between sessions on how to apply lifestyle medicine to their daily lives and build health habits. This program differs from the St. Luke's Intensive program as it is not medically supervised and does not provide individual health coaching and exercise options. To learn more, search the PVO program at stlukesonline.org. There is also a free information session to learn more before you sign up. You can call 208-381-9000 to sign up for an informational session or for the program. St. Luke's Lifestyle Medicine does offer a variety of community classes taught by lifestyle medicine staff members that are open to everyone. These classes take place online, so you can learn from home. Classes are taught by lifestyle medicine staff who are also involved in the intensive program. Find upcoming classes at stlukesonline.org by searching lifestyle classes. While not directly a lifestyle medicine program, if you are looking for supervised exercise in a safe environment, enhanced fitness classes are held in person at your local YMCA. You do not need to be a YMCA member to participate. It's free for Y members, and often Y membership is paid for by your health insurance, especially Silver Sneakers. It is an ongoing program for over 4 months and can be repeated as often as you want to. It provides a social benefit and promotes a physically active lifestyle. Reach out to your local YMCA to learn more. If you have any additional questions or are struggling to find more information, feel free to contact us directly at Lifestyle Medicine by calling 208-706-9710 or sending an email at lifestylemedicinymca@slhs.org. I've appreciated sharing this information with you. Thank you and have a great day.